Right now, while you're reading this, your hands are telling you something your last blood test completely missed. Not tomorrow, not in 6 months when you finally get that follow-up appointment. Right now, tonight, while you're sitting there, your hands are sending signals that cardiologists are trained to look for the moment a patient walks through the door. Before the stethoscope, before the EKG, before a single test is ordered. Most people look at their hands 100 times a day and see nothing. They see wrinkles. They see age spots. They see the same hands they've had for 60, 70, 80 years. But a trained eye sees something completely different. A trained eye sees a window directly into what's happening inside your heart, your arteries, your circulation, right at this moment. My name is Dr. Marcus Ellis. I've spent over 2 decades practicing internal medicine, and I want to tell you something I tell every patient who sits across from me for the first time. The most honest thing your body does is show you what's wrong before it becomes a crisis. Your body does not stay silent, it speaks. The problem is nobody taught you the language. Today, I'm going to teach you that language. 7 specific warning signs that appear in your hands, often at night, that mean your heart is quietly struggling. For each one, I'm going to tell you exactly what most people think it is, what your body is actually telling you, and one thing you can do starting tonight. Not next week, tonight. Stay with me through all 7 because sign number 5 is the one that stops people completely when they first hear it. And sign number 7 is the one that almost no doctor mentions in a routine appointment, but every cardiologist knows exactly what it means. Let's start right now. Sign number 1. Your fingers turn white or blue in a warm room. Patricia was 68 years old. Retired school teacher from Ohio. She came to me not because of chest pain, not because of shortness of breath, but because her daughter had noticed something strange at dinner one evening. Patricia's fingers had turned white, not pale, white, and the room was perfectly warm. Patricia told me what she'd been telling herself for 2 years. "Doctor, I've always had cold hands. My mother had cold hands. It's just how I'm built." I hear this constantly, and sometimes that's exactly true. But when fingers change color, turning white, then blue, then flushing back to red, in a warm environment, without any cold trigger, that is your body showing you something specific, something with a name. And that name is Raynaud's phenomenon, secondary to cardiovascular compromise. Here is what is actually happening. Your heart is responsible for pushing warm, oxygenated blood all the way to the tips of your fingers. That is one of the longest journeys blood makes in your entire body. When your heart is struggling, when the arteries carrying that blood have narrowed or stiffened from years of elevated blood pressure or plaque buildup, the blood flow to your extremities becomes inconsistent. Your fingers are literally the last stop on the route. When the supply drops, the blood vessels in your fingers clamp down in response. The color drains out, white first, then blue as oxygen depletes, then red as blood finally rushes back. Think of it like a city's water pressure. When the main pipes have a problem, the buildings furthest from the source are the first to lose pressure. Your fingers are those buildings, and when they keep losing pressure even on warm nights, something is wrong with the main line. A study published in the journal Circulation found that secondary Raynaud's phenomenon in adults over 60 is associated with a significantly elevated risk of peripheral artery disease and underlying cardiac insufficiency. This is not a cosmetic issue. This is a circulation issue. What to do tonight? Look at your hands under normal indoor lighting right now. Press your fingernail for 5 seconds, then release. The color should return within 2 seconds. If it takes longer, your peripheral circulation needs attention. Write that down and bring it to your next appointment. And if your fingers are turning white or blue in a warm room, do not wait for your next scheduled physical. Call your doctor this week. Sign number 2. You notice swelling in your fingers that's worse in the morning. Here's what almost every patient tells me about this one. Doctor, I can't get my ring off in the morning. I figured I'd gained a little weight. And yes, weight changes can cause that. But there is a specific pattern of finger swelling, worse after lying down, better by midday, that has nothing to do with weight and everything to do with how your heart is managing fluid overnight. When your heart is not pumping efficiently, fluid accumulates. Gravity normally pulls that fluid down to your feet and ankles during the day. But when you lie flat at night, that fluid redistributes throughout your body, including your hands and fingers. By morning, that fluid has been sitting in your tissue for 6 to 8 hours. The swelling is most visible. The ring won't slide off. The fingers feel stiff and thick. Most people stretch their hands, run them under warm water, and move on with their day. By noon, the swelling has gone down, and they've forgotten about it. But it happened again last night, and the night before, and the night before that. This pattern, called positional edema, linked to reduced cardiac output, is one of the earliest visible signs that your heart is working harder than it should to maintain circulation. Your heart is not failing dramatically. It is struggling quietly, and it is showing you that struggle every single morning through your hands. Think of your heart as a pump in a water system. When the pump loses just 10% of its efficiency, the system backs up. Fluid that should be moving gets stuck, and it always pools in the places gravity forgets at night: your hands, your face, your lower back. The American Heart Association identifies unexplained peripheral edema as a clinical indicator warranting cardiac evaluation, particularly in adults over 60 who have no prior diagnosis of kidney disease. What to do tonight? Before you go to bed, look at your hands. Notice how your rings fit. When you wake up tomorrow morning, check again before you get up. If there is a visible difference, if the rings are tighter, if the fingers look puffier, start tracking this. Take a photo every morning for 1 week. That documentation is more valuable to your doctor than anything you can describe verbally. Sign number 3, a persistent tremor in one hand that appears only at rest. I want to be careful here because tremors have many causes, but there is a specific type of tremor that appears only when the hand is completely still, not when you're using it, not when you're reaching for something, only at rest, that deserves serious attention in the context of cardiovascular health. James was 72, former engineer. His wife noticed his left hand shaking while he watched television. When James reached for his coffee cup, the tremor disappeared completely. The moment he set the cup down and relaxed his hand, it started again. James assumed it was early Parkinson's. His neighbor had Parkinson's, and the shaking looked similar. But when I examined James, we found something different. His resting tremor was connected to irregular cardiac rhythm, specifically to episodes of atrial fibrillation that were sending inconsistent blood flow to his brain and peripheral nervous system. Your hands are neurologically one of the most sensitive parts of your body. The nerve pathways that control fine motor function in your fingers require steady, consistent blood flow. When your heart beats irregularly, even subtly, even in ways that don't cause chest pain or dizziness, those nerve pathways experience momentary drops in supply. The result can appear as a tremor, a slight rhythmic shaking that comes and goes. That only appears when the muscles are relaxed and demand on blood flow drops. This is not the hand shaking when you lift something heavy. That's fatigue. This is the hand shaking when it's doing absolutely nothing. That distinction matters enormously. The Heart Rhythm Society identifies undiagnosed atrial fibrillation as one of the leading causes of stroke in adults over 65. Many people with AFib have no chest symptoms whatsoever. Their first indication is something subtle, a tremor, an unusual fatigue, a strange feeling that something is slightly off. What to do tonight? Sit completely still in a quiet room. Rest both hands flat on your thighs. Watch them for 60 seconds without moving. Any rhythmic movement in the fingers or a slight shaking in one hand that you haven't noticed before is worth documenting. If you see it, do not dismiss it as nerves. Mention it specifically to your doctor. Ask for an EKG. That test takes 10 minutes and can detect atrial fibrillation immediately. Sign number 4. Your grip strength has dropped noticeably in the last year. This one is hidden. You won't see it by looking at your hands. You'll feel it. The jar that used to open easily now requires your spouse's help. The grocery bags that you carried without thinking now feel genuinely heavy. You notice it opening bottles, turning door handles, wringing out a washcloth. Most people file this under getting older. Muscle loss with age is real, but there is a specific, documented connection between declining grip strength and cardiovascular health that most people have never heard of, because most doctors don't mention it in a 15-minute appointment. A landmark study published in The Lancet, one of the most respected medical journals in the world, followed nearly 140,000 people across 17 countries and found that grip strength was a stronger predictor of cardiovascular death than blood pressure. Read that again. Grip strength, stronger predictor than blood pressure. Here is why. Your grip strength reflects the overall health of your skeletal muscle, and skeletal muscle health is directly tied to how efficiently your cardiovascular system delivers oxygen and nutrients to your body's tissues. When your heart and arteries are struggling, your muscles are among the first systems to show the deficit. The hands, being at the far end of your circulation, show it earliest. This is not about how strong you are. A former marathon runner and a person who never exercised can both experience grip strength decline for the same cardiac reason. It is about the rate of change. Gradual loss over 10 years is different from noticeable loss over 12 months. What to do tonight? Find something with a handle in your kitchen, a mug, a water bottle, anything. Grip it as hard as you can for 10 seconds. Notice if one hand feels significantly weaker than the other. Notice if this feels harder than it did a year ago. This is not a clinical test, but it is a signal. And if your grip has dropped noticeably and recently, that is a conversation your doctor needs to hear. Sign number 5. Blue or purple veins suddenly becoming much more visible. Stop for a moment. Look at the back of your hands right now. Are the veins more prominent than they were 2 or 3 years ago? Are they standing out in a way that seems new? Are they darker, bluer, more rope-like than you remember? Most people assume this is simply aging skin. The skin thins with age, fat under the surface diminishes, and veins become more visible. That is true and completely normal. But there is a specific change in vein appearance that is not just about skin thinning. When the veins in your hands suddenly become more prominent, darker in color, and more visible in a relatively short period of time, particularly when accompanied by any of the other signs we've discussed, this can indicate increased venous pressure. Here is the mechanism. Your cardiovascular system is a loop. Arteries carry blood away from your heart. Veins return it. When your heart struggles to receive blood efficiently, pressure builds in the venous return system. That backed-up pressure pushes outward into the veins closest to the surface. The veins in your hands, already visible through aging skin, become dramatically more prominent. They bulge slightly. They darken. They seem to appear overnight. Think of a highway where the off-ramps are congested. Traffic backs up onto the main road. The road that was flowing freely yesterday is now visibly jammed. Your veins are those roads, and when they suddenly look more congested than they used to, the question worth asking is what changed downstream. Research published in the European Heart Journal identified elevated central venous pressure as a measurable marker of right-sided heart strain, a condition that frequently develops silently in adults over 65, particularly those with long-standing high blood pressure or sleep apnea. What to do tonight? Hold both hands at heart level with your palms down. Look at the back of your hands in good lighting. Now drop your hands to waist level and look again. Veins naturally fill more when lowered. That's normal. What you're assessing is the baseline visibility at heart level. If those veins are dramatically more pronounced than they were a year ago, photograph both hands and show your doctor. A photo is worth more than a description. Sign number 6. Tingling or numbness that wakes you up at night. You wake up at 2 a.m. Your hand is completely numb. You shake it out. The feeling comes back. You go back to sleep and forget about it by morning. This has happened to almost every person over 60. And almost every person over 60 assumes the same thing. I was sleeping on it funny. I cut off the circulation. Sometimes that is exactly correct. Positional compression of the ulnar or median nerve while sleeping is common and harmless. But here is the question I always ask my patients. Does it happen regardless of which side you sleep on? Does it happen in both hands? Does it happen when you're not sleeping at all, when you're sitting quietly, when you're watching television with your hands in your lap? Because numbness and tingling in the hands that appears without positional explanation, particularly at night when the body is at rest, can be a sign of something your sleeping position has nothing to do with. It can be a sign of compromised circulation to the peripheral nerves in your hands, driven by the same vascular insufficiency we've been discussing throughout this conversation. Your nerves require a constant, uninterrupted supply of oxygenated blood to function. When that supply becomes inconsistent, even briefly, even in small amounts, the nerve signals misfire. You feel tingling. You feel numbness. You feel that buzzing pins and needles sensation that should only happen when you compress a nerve directly, but is now happening without any pressure at all. There is also a cardiac arrhythmia connection here that most people never hear about. During certain arrhythmias, brief drops in cardiac output reduce peripheral blood flow for seconds at a time. Those seconds are enough to trigger numbness in the hands, particularly in the small hours of the night when your heart rate naturally drops and any irregularity becomes more pronounced. The American Academy of Neurology identifies nocturnal paresthesia, the medical term for nighttime tingling and numbness, as a clinically significant symptom in seniors when it occurs more than twice per week and cannot be explained by sleeping position alone. What to do tonight? Keep a notepad by your bed. Not your phone, a notepad. Every time you wake up with hand numbness or tingling, write down the time, which hand, and what position you were in. After 1 week, look at the pattern. If it's always the same position, likely positional. If it's random, both hands, different positions, different times of night, bring that notepad to your doctor. That 1 week of data can change the entire direction of your evaluation. Sign number 7. Dark streaks under your fingernails that you've never had before. This is the sign almost nobody talks about. The sign that is not in any patient brochure I have ever seen. The sign that most people walk past every single day without a second glance. And the sign that, when I see it during an examination, tells me something needs to be investigated immediately. Look at your fingernails right now. Not the surface, underneath. Look at the nail bed, the skin you can see through the nail itself. Are there any dark red or brownish streaks running vertically? Thin lines, almost like a splinter is trapped under the nail that you did not put there from an injury. These are called splinter hemorrhages, and they have nothing to do with splinters. Splinter hemorrhages are tiny bleeds under the fingernail caused by microdamage to the small blood vessels in the nail bed. In younger adults, they occasionally appear after significant hand trauma. But in adults over 60 who have not injured their hands, splinter hemorrhages appearing spontaneously under one or more nails are a documented clinical warning sign. Here is what causes them. When inflammation is present in the blood vessels themselves, a condition called vasculitis, or when emboli, tiny fragments of clot or debris, are being released into the bloodstream from a damaged heart valve or from arterial plaque, those fragments can lodge in the tiny capillaries of the nail bed and cause a small bleed. That bleed appears as a dark vertical streak under the nail. This is one of the reasons cardiologists look at a patient's fingernails before they look at anything else. Because those streaks, when not caused by trauma, can be a sign of infective endocarditis, an infection of the heart valves, or of embolic events from unstable arterial plaque. Both are serious. Both are treatable when caught early. And both are silent until they are not. A study in the New England Journal of Medicine identified splinter hemorrhages as one of the peripheral signs of cardiovascular disease most frequently missed in routine primary care examination. Not because doctors don't know what they mean, but because patients rarely mention them and doctors rarely look. What to do right now? Not tonight, right now. Look at all 10 fingernails in good lighting. Tilt them toward the light source. Look through the nail at the nail bed underneath. If you see dark vertical streaks that are not from a recent injury, do not wait for your next annual physical. Call your doctor tomorrow morning and describe exactly what you see. Use the words splinter hemorrhages. That phrase will tell your doctor immediately what you're looking at and what needs to happen next. Here is what I want you to understand before this video ends. Your heart has been working every minute of every day since before you were born. It has never taken a day off. It has never asked for credit. And when it starts struggling, it does not send you a sharp, dramatic signal most of the time. It sends you quiet ones. A color change in your fingers. A ring that won't slide off in the morning. A tremor that disappears the moment you reach for something. A streak under a nail you've been ignoring for 3 months. These are not random. These are not simply aging. These are communications from a body that has been trying to get your attention through the only language it knows. You now know that language. I want you to do 3 things before this video ends. First, look at your hands right now, under good lighting, and go through each of the 7 signs we discussed. Second, if you see anything that concerns you, write it down with today's date and a description of exactly what you see. Third, if you see the dark streaks under your nails, the blue or white color changes, or the tremor at rest, do not wait for a scheduled appointment. Call tomorrow. The earlier these signs are caught, the more completely they can be addressed. Not through fear, not through dramatic intervention in most cases, but through a conversation with your doctor that starts with the right information. You worked for this life. You earned your independence, your ability to do what you love, your time with the people you care about. Do not let something your hands were already showing you take any of that away simply because nobody told you what to look for. Now you know what to look for. Share this video right now with someone you love. Not tomorrow, right now. Tag them. Send it to them. You might be giving them information that changes everything. And if you want more conversations like this one, I post every week on this channel. Real information, explained plainly, about what the research actually shows for adults over 60. Subscribe. Bring someone with you. I'll see you in the next one. Take care of those hands. They've been taking care of you your entire life.